Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo, who has all the knowledge, and I'm just the color. I'm just the sweetening. So it's a rainy day, and it has been a rainy day for months. Do you get aches and pains days like today?
Oh gosh, yes.
Really?
Yeah, people that know me and have seen me in person know that I walk funny.
Oh, wow.
And then, so I have a lot of arthritis.
Okay.
Yeah.
Okay. So connection between arthritis and ambient environmental factors. That's a real thing.
Yeah.
Wow. Okay.
Yeah.
Huh. That was the only
That's
way.
why Mike Thornton doesn't live here anymore, I bet.
Yeah. It's a little different in Arizona. Okay. So arthritis, the topic today, and I know next to nothing about arthritis. What it is, how it happens, why it happens, what you can do about it. Like really nothing. I don't know why.
Well, then stay tuned.
All right,
So
okay.
what it is an inflammation of the joints that causes pain and stiffness.
What part of the joint is becoming inflamed?
The actual articular surface, which is where the two bones come together.
Mm-hmm.
So a joint is a connection between two bones. There can be hinge joints. There can be like joints that are like tectonic plates that are kind of sliders.
Right.
There can be kind of ball joints like, hips or shoulders.
Mm-hmm.
But right on the surface, inside the joint capsule, where the two bones kind of come together, there is, at least a possibility of arthritis if somebody has had some wear and tear.
Okay. Oh,
Okay.
wow. Somewhere yeah.
Which we almost all do. That would be
Right.
called life. So. And there's multiple types of arthritis. So osteoarthritis, I just kind of alluded to. Autoimmune arthritis, like rheumatoid arthritis, super common up here, especially with Native women.
Really?
Also psoriatic arthritis, super common up here. I don't know why that would be, though. Reactive arthritis, which probably the best known situation would be like Lyme disease. Like some people have knee pain, and when they initially get diagnosed with Lyme, it's a presenting symptom.
Wow. Okay.
Yeah. Or oftentimes people will get, an infection, especially young men. When they get chlamydia, sometimes they can get a more systemic involvement and have joint pain.
Wow.
So that's a reactive arthritis. So
Okay.
the joint's reacting to an infection that's somewhere else in the body. And then crystal causes of arthritis, like gout. So gout is uric acid crystals that are circulating, or actually uric acid is circulating in the bloodstream, and then something happens or some stimulating event, and then the uric acid precipitates out and goes and lives in the joint. Super painful.
Ouch. That sounds super
really
painful.
painful.
Like getting sand in your joints.
Yeah.
Me.
Yeah, exactly.
Okay.
So arthritis is a big cause of chronic pain, and recently thought to be best treated with opioids. And there's like a lot of people who unfortunately had their arthritis treated and then got all their opioids taken away because that was not the best thing to do for them. Although it was a dysfunctional and kind of knee-jerk thing, I think, and it left people in really bad situations, which are ongoing. So, although some people still get opioids, I'm not really sure how in medicine we decide who gets them and who doesn't.
Really?
Yeah.
Just kind of a case by case.
Keeps me awake at 2 a.m.
Case by case, what kind of day are you having sort of decision?
Yeah.
Wow.
Yeah, and there's a lot of prejudice heaped on that. So, but the real unfortunate thing is that patients previously treated with chronic opioid therapy are now the way they experience pain is different, and they're stuck with bigger issues.
Right, because it rewires you, right?
Right,
Yeah.
you rewires your brain, so your whole experience of pain is more intense. So, they get the opioids taken away, they have a chronic pain issue, the way they experience it is worse, and then, God forbid, but if they go on to have another source of pain in their life, say, bone cancer or something, they're just in like incredible agony.
Wow.
It's really sad. But the treatment for arthritis depends on the cause of arthritis. So I'm going to leave osteoarthritis for the end because that's the most relevant to us. But autoimmune arthritis has exciting new immune modulating treatment that helps stop joint destruction, which is super important because once there's damage to the joints, you really can't repair that.
Right.
I mean, I suppose you could get it like a knee replacement or something, but I don't think that makes people's pain issue go away. I think it might improve it somewhat, but I don't think it's 100%. So,
And this is what you were talking. This is like the rheumatoid arthritis.
this
right?
is
Yeah.
rheumatoid arthritis or psoriatic arthritis. And these treatments have significant side effects because they're changing the way the immune system works, right? And people are super nervous about them.
Mm-hmm.
And like one woman recently in our clinic started on one of them, and she was like emotionally distraught because, you know, she was more focused on the side effects than she
okay.
was in the benefits.
Oh,
So she
wow.
came from a place of fear. Luckily, Nurse Erin calmed her down, and you know we got her through it. But it was a big leap of faith for her, and not everybody is comfortable with these new drugs.
It just occurred to me probably not every healthcare provider worker is capable of talking somebody down from something like that too. Is that something that is that actively taught, or is that just you got it or you don't? That's a personality trait.
It's a little bit you got it or you don't, but PAs are actively taught that. Yeah.
Really?
Yeah, we're
Okay,
taught to be communicators and translators. So, but Nurse Erin, born with it,
Really, yeah.
superstar.
That's wonderful.
So he was able to, and he's also a pretty logical guy, and without being like judgy.
Okay.
Yeah.
Okay.
So he can make people kind of see their way through it. So reactive arthritis, remember that's like the Lyme or chlamydia. That's self-limiting, and if you treat the problem,
Sure.
it tends to, you know, keep further joint destruction from happening. And
Right.
oftentimes those are picked up super early because there's other things going on, and you know, it's pretty apparent what the underlying cause is. So, and keeping joint damage, this is a reoccurring theme in this. Keeping joint damage minimal is like super important.
Right. Because it's like I was gonna trying to come up with the right metaphor for it, and I was reaching around for like a forest fire, but the forest grows back, but not your joint. Once the damage
Right.
is done, it's
It
done.
doesn't, and then you know, like every step you take, you're thinking about it.
Yikes.
So the crystal causes are mostly gout, and there are great medications that not only treat the acute outbreak, but also treat or like maintenance therapy to keep people from actually being in a place of an acute outbreak.
What's another crystal cause?
Oh God, I was
Arthritis.
hoping you wouldn't ask that.
Oh, I'm sorry. Gout. You keep coming back to gout, and I don't know.
It's because it's the only one I could think of.
Okay. Because I couldn't think of anything like it, and I'm trying to. So yeah, don't worry about it. Sorry.
Yeah, maybe I'll come up with. I think it might be the only one. So, but here's osteoarthritis. This is the
No,
big
before
one.
we skipped over at the
Yeah.
end of the gout when dietary changes are
Oh yeah,
important.
dietary changes. So that's the kind of another theme in this talk is that there's a lot patients can do for themselves. They're not oftentimes counseled about it.
Mm.
You know, dietary changes. I oftentimes give people the 8th grade literacy handout, and I'm certain it goes in the backseat of the car. In
What
about 10
with like the
minutes.
food pyramid and things like that, or
Yeah,
what?
it sounds too much like maybe shaming.
Yeah,
And it's not
yeah.
meant to be. It's supposed to be. The word diet does not necessarily have to go to weight. Okay.
Oh,
it
I
can be
see.
disease
Okay.
management in other ways, like dietary approaches to stop hypertension.
Right,
For
right.
example, is not a weight loss diet, although people might lose weight on it, but that's not the goal.
Yeah.
The goal is to decrease sodium and increase potassium.
Sure, but they just have so much connected with the word diet.
I know,
It's like,
they just look like puppies that have been yelled at when I say that. And then I have to immediately say, no, this isn't a weight loss diet. This is to help you from getting acute outbreaks again.
Right.
So-
I like the phrase lifestyle.
Yeah.
Or like lifestyle changes and things like that kind of encompasses all sorts of things like that.
Right.
But
It's kind of we talked about chronic pain toolboxes before. And those are the people. The other theme in this is that people with arthritis expect you to give them a medicine to make it like normal again.
Oh, wow. Okay.
And none of, see, I saw your light bulb go
Yeah,
off.
yeah.
None of these medicines are really going to be able to do that. You can't turn back time on this one.
Wow.
Okay.
Wow. Okay. All right.
So that's a super important thing to remember, because I think in the exam room that the provider kind of expects the patient to understand that. And, you just demonstrated that maybe that's not the
Well,
case.
no, the
sometimes.
arthritis is like a chronic diagnosis. This is what's going on now.
There are tools you can use to help yourself feel better,
Mm-hmm.
but one of your tools is acceptance.
Oh, wow.
I know, isn't that heavy?
Thanks, doctor.
Yeah, I'm not a doctor. But I like acceptance. We'll get into that.
Okay.
So osteoarthritis, huge, big, enormous problem up here.
Why
Really,
specifically up here?
because of lifestyle.
Okay.
So this problem is the outcome of life in a world affected by gravity. Okay.
All right.
So, it's affected by what you did for your job, or, injuries that you had, maybe even that skateboarding accident
You're
when
talking
you were
like
15.
Yeah, over time, your entire
over
lifespan.
time. This
Gotcha.
is the sum total of your life.
Oh,
but
my God.
definitely about weight. So weight issues are kind of a thing here. And aging, how are you going to, you have to keep aging, right? Or otherwise you'd be dead.
I've chosen to stop
Yeah,
aging.
you did? Okay. Ooh.
I'll let you
That's
how
creepy.
that goes. Yeah.
So-
I got a painting up in my attic.
But there's a lot of people around here that are stove up, especially a lot of the elders, and they use that. I'm sure you've heard that before. And I think a lot is because they worked in the logging industry when they were younger, so they were their bodies were kind of pounded on, and fishing would be part of that. And they didn't really take time off to care for themselves, and their job wasn't the kind of job that said, take a couple weeks
self-care
off
day,
and
yeah.
heal. Yeah.
It's crab season comes around once a year. Keep working.
But the horrific thing is you can see, especially these older men, you can see them lying back on an exam table and their body is actually bowed.
Oh, wow. Just like
So they can't lie flat.
Yeah, yeah. Wow.
And it's so they're there with their head raised about, 6 or 7 inches above the table, like they're doing a semi crunch.
Oh, yeah.
And they're just stuck there.
Oh, my God. Wow. Just totally tense all the time, forever.
Horrific.
Well, I mean, I've noticed, okay, I'm 55. I'll be 56 in about a month. And one thing I've noticed just physically in the last 5-6 years is that yeah, it's the problems I have don't seem to be like new problems. They are old problems. I don't know.
Yeah.
There are things that, it's always been like that. Or, I feel this way in this leg and this hip because I've walked this way for so many years. It is the
Exactly.
sum total of all this wear
Right.
and tear.
Yeah,
But that
it
leads
is.
to
But people don't think of that, because let's say you're 12, you fall off your skateboard, you break your ankle.
You back up into
You have
story.
some treatment.
Right.
6 weeks later, you're on your skateboard again.
Yeah.
No big deal.
Yeah.
But when you're 45,
And you feel it again.
you wonder why your ankle hurts.
Oh my God. Oh, this is not
Yeah.
going to, because I've got so many of those. This makes me feel bad. So how's this going to make me all bent up and arthritic?
Stove up.
Stove up.
Yeah. So, the important thing to know is something you actually do. The most important thing that helps, weirdly, is exercise.
No, keep it moving. Keep it loose,
it's
right?
a move it or lose it thing.
Wow.
And so exercise, people will say, but when I do that, I feel worse. Well, maybe your joint hurts more, but the endorphins are helping you with your pain. The, depression of having chronic pain is lifted a little bit. We've talked about how exercise helps that.
So much.
Right. And it keeps you able to move. And I think the most important part, like I'll use yoga as an example because I'm big into it right now, is that so I got knee problems because of the way I walk, but yoga helps the muscles that kind of are around my knee joint be more effective at protecting the joint. And so it's hard for people to see that, though.
Yeah.
Yeah.
Yeah, because it's like, I've noticed that too. It's like working, if I had like lower back problems, and working on other parts of my body alleviated that. And that's like counterintuitive, keep working the
Right.
lower back, make it stronger. No, give it the support it needs to do its job without
Right.
stress. Yeah.
And so here, a lot of people are like into splints and stuff like that. Like some people wear wrist splints for like years.
Wow.
And that actually does the opposite.
Mm-hmm.
So it might help their, body part feel better because there's warmth around the area, and that
Sure.
tends to be soothing.
Support.
But if you take it off, you can see how atrophied they look.
Oh, yeah.
Especially if it's a wrist problem, because that affects how their hand works
Mm-hmm,
then, right? But also people really, really like steroid injections, which are done. I don't do them. Because I'm an infectious disease kind of provider, and I see the downside is way huge. But people really, really want them all the time, and a lot of them get them. I think that's a huge bad idea.
That would be an interesting topic for down the road too. Because steroids. It's like
Right.
That's a thing. So so I was just going to get off in that whole thing.
So what do steroids do? We can talk a little bit about it. I think we have some time.
It affects inflammation, right?
Right, it thins bones, right?
It thins bones?
Yeah. Not in a regular way, though.
That's not, but
it's not like it's sanding down the little bony prominences that are actually what you see if you look at bones that are arthritic.
It's like reducing mass, huh?
Yeah. It's making them less strong. And then it makes your sugar go up, and it makes you anxious sometimes.
Wow.
It makes your immune system not work as well. It could cause people to gain weight a little bit. So I think it's the wrong direction to go. For 3 months of not hurting, I don't know. But people get them every 3 months, on and on and on.
Wow.
So, so exercise, maintaining healthy weight helps immensely. And the best form of exercise we probably have here is the pool. Once again. Yeah, shout out to the pool people. Because why? Can you guess?
Well, range of motion and resistance in every direction.
Except for gravity. Especially if you have back pain, you don't really,
okay,
if you're water walking
or
something,
then
you
that's
don't really
also...
have gravity affecting your spine. It's not like a big crunch downward. So, in fact, when I get in the deep end, if I'm just floating in the deep end, head up, feet down, I can feel my back pop. Pop,
just
pop, like a xylophone. Yeah, so super helpful. And then, of course, you get the endorphins and you get the muscle strengthening. So, and it's kind of cold. To be fair, I think our pool is a little cold.
Is it?
Yeah, so it's kind of like an ice pack.
Okay.
Yeah.
And it's a very social thing.
Oh yeah, and nobody cares what you look like in a bathing suit.
And you just walk in doing that shimmy across the pool, talking, and it's a lot of fun actually. Yeah. I think I'm just about ready to not that particular angle of the pool, but it's about time. It's been COVID and years and all kinds of things, but I'm just about ready to get back.
I went back Friday nights. I would really endorse Friday nights.
They have an open swim?
7-10. Yeah.
Okay.
Yeah. Okay. For individual exercise, I don't think they have an organized pool exercise class that day. No, I was the only one in the pool the last time I went there on a Friday night.
Do they have lane too? Do they have a couple of lanes?
Yeah, they had a couple of lanes, but I was water walking and I kept thinking, sharks don't live in chlorinated water. Killer whales don't live in chlorinated water.
Okay, so
a little weird.
No, thanks for the tip.
Yeah.
No, because Friday night, that'd be great. That would be really cool. Okay, cool.
Yeah.
Good.
Yeah. So other tools that help with pain include Tylenol. Is probably the best one for elders with aging kidneys. Non-steroidal anti-inflammatories, which have limitations if somebody's on blood thinners or has, ulcer disease, or a lot of people kind of had allergies. I don't know how real they are, but told us about allergies in the direction of hoping to get different drugs.
Oh, gotcha.
So Lidoderm, so that's lidocaine.
Oh, okay.
Patches, but it can also be gel. My super favorite thing, not very helpful for things like knees that bend, but you can cut them from their normal, maybe 4x6 size before you peel the backing off to reveal the adhesive. And you can put them on strips and stuff, which might be more efficient for bending joints. But they work really, really well for lower back pain. Super well for SI joints, which is lower back. And then they're also over the counter. You don't need a prescription. They go by the brand name Salon Pause. But be careful what exactly you're buying, because Salon Pause has a number of different patches. I would go for the 4% lidocaine.
Okay, no, I've seen that. I've seen that with and I've seen that word. I didn't realize it was a brand name.
Yeah, it is.
I've seen it with sports stuff.
Right.
Okay.
I
All
think
right.
they have
Silopause.
mentholated patches, and then Lidoderm was prescription for a while, and then it went over the counter.
Okay.
So, but people like at UHS or on Medi-Cal can get their provider to pay for them if the provider sends a prescription.
Oh, okay. You can
So
get
I usually
okay.
give people like 30 with a
Is
year's
that-
worth of refills.
Is that a common end around like that? Even for an over-the-counter product, if you get a prescription for it, then it's part of the system and it
Right,
can be paid
especially
for.
with partnerships, especially at UHS.
Okay.
So, and then there's topicals like Bengay and Tiger Balm, and people roll their eyes, but I think they can be helpful, especially in the native community wormwood. And if you know somebody that makes good wormwood, I mean, the elders swear by it. I actually found it helpful too.
Really?
Yeah.
Like a poultice? Like what is it you've got that you put on?
It's like a salve.
Okay.
Like Bengay.
Okay.
Kind of a ointment-y thing.
Mm-hmm.
And you just rub it on the joint. Now, it's usually made by people in a cottage industry kind of
Sure,
situation.
right.
So you probably get some people that can, their craft is better than others.
Right. There's
but-
going to be variance.
So don't try it once and then blow it off, because I would shop around and ask who makes the best. And I think it's also available outside the native community. I'm sure other crafters make it.
Okay.
Arnica is kind of in the same boat. You can buy that at Wild Rivers. That's a topical. But topicals are really helpful. So anti-inflammatory diclofenac, which is also called Voltaren, is over the counter in a topical. And again, if you get your provider to write for it, you won't have to pay for it. It's kind of expensive. And I like it a lot. I use it on my hands after a busy day in clinic from the typing and stuff. And so that's really, really helpful. But I think the best pain control measure for osteoarthritis is a bag of frozen peas.
Frozen, ice,
Yep.
frozen peas, cold. That's
And I would get lima beans because they're a little bigger and they kind of stay cold longer.
Oh,
And
okay.
Nobody's going to eat your bag of lima beans.
Trust
and you
me.
Can, and you can just reuse it, and it's just your bag. I think it molds nicely to like an anterior knee.
Okay.
And it's good while you're binging on Netflix.
So just I want to be clear that so arthritis. Once you got it, you got it.
Yeah.
And you can lessen the condition that causes the pain, but you're not going to undo any damage that's occurred because of the
Right.
pain. How? I mean, and I suppose it depends on the severity of the arthritis before it's addressed.
Right.
The pain
Probably
that
the etiology, so the cause
right.
also.
Okay.
Yeah.
So it's just wow. So there's no real. Am I thinking about it wrong? Is there no real treatment for arthritis then? Or is it just a bunch of treatments? Because arthritis is what you're talking about when you say arthritis, you're describing a condition. You're not talking about an illness per se.
I suppose a joint replacement could be a treatment, but I don't think that is 100%.
Yeah.
Especially if somebody has a gait disorder.
Well, it seems like you'd be, I mean, I don't know the ins and outs of joint replacements too, but you're going to have a lot of interfacing between, bone and thing and
Yeah.
replaced joint.
And metal thing.
And
yeah.
if you're already prone to arthritic responses,
Hey.
wouldn't that be?
Surgery does cause more arthritis
Wow.
eventually,
Wow.
at least surgery on bones.
Okay.
And then, they're just starting to do shoulder replacements. So
Really?
joint replacements are hip and knee, starting to get good at shoulders. They've been doing it for a while, but they were lousy, and so now they're better. But like, how about hands? Like the base of your thumb is, especially on your dominant hand, especially in somebody who types a lot, that's the place that gets really affected. And then you lose the integrity, and then you lose the ability to pinch.
Oh, wow.
Okay, and that's
That's a
holds
key motion.
in your
Right.
dominant hand. That kind of holds the pen or the pencil. Maybe it's affecting how you shake hands, depending on which hand you're dominant. That like separates us from the apes. That's a huge big deal, and there's no joint replacement there.
Wow.
Maybe somebody could get a steroid injection, but like I said, that's not really solving the problem. That's like covering it up for a couple of months.
Okay, so what is this in my hand?
Oh, you have a trigger finger.
What's that again?
So Paul is showing me his left hand, and his fifth finger, and his left hand is bent at the
my
joint in the middle
the
of
medical
the digit.
term is it's my pinky.
Yeah, oh, we're going pinky. Okay. Oh, I see. Okay.
This little piggy.
Yeah,
Sums up.
You look like you injured it at one time, and now you've lost the ability, I think, for the tendon to work. Can you snap it open, or is it just stuck like that?
It's stuck
so
like
maybe
that,
you
yeah.
avulsed the tendon. That might be a tendon problem. I haven't followed you around your whole life. So
It's just something I started feeling like a hard thing in there.
Oh, okay.
And then it just kind of froze up.
Okay. So you have a Dupuytren's contracture. Then I can kind of see it now that you move your hand that way.
Yeah, see.
Yeah, so that's the problem with the tendon becoming kind of like old shoe leather or
Oh, wow, okay.
sclerosing.
Okay.
Now, a steroid injection might be good because you could get a lot of function back, but I think at that point you need surgery if that's the direction you want to go.
Yeah, wow.
But that's not arthritis, so.
Okay,
Yeah,
good. I was worried it was arthritis, and I was going, oh my God, that's just something messed up with that tendon.
No,
Okay.
that's a flexor tendon problem.
I've got, because this is my guitar playing hand. And-
Yeah.
And I can't, so it's limited now. It's limited my guitar playing, and then I can't stretch, I can't extend that pinky. So that's cut down a little bit. Makes I play and I feel fine kind of hard. But
So there's actually good resources in town for that. So
Really?
the orthopedists that are associated with Sutter are really good at. They're not really hand specialists like Dr. Duncan was, but they're good at fixing this problem. And then there's a physical therapist in Arcata who is a hand physical therapist.
really,
Oh my God! And she's amazing.
okay.
So
Maybe I gotta look
yeah, you
into
have. Weirdly enough, you have resources for
Huh,
that here.
that is not, yeah, that's kind of, that's the exception proving the rule, I think, for us up here,
Right.
too, is that to have actual resources. Okay, well, cool. I always thought that was arthritis, but now I can.
So I want to just go back to the acceptance. So my
Yeah.
problem with my knees, I do walk funny and my knees are trashed because of it. But I spent a lot of time hiking when I was younger, and like summers in the Sierra, et cetera, like many of us. And when my knees are really hurting, if I think, oh, that was the trip out of Tuolumne Meadows,
That's sweet.
and it makes me smile,
Yeah.
and they feel better.
Yeah. 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 No, I can get that. Yeah.
Yeah.
I
So I feel like my miles on tires were well spent.
Right, exactly. Like I don't want to leave when I'm done with this body. I don't want it to be like, still in its original wrapper somewhere,
Right.
I want it,
Right. Life well lived.
right,
Yeah.
right, exactly. So
You'll be
that's
stove up in your coffin, and they'll like everybody will go, "Yeah, he was a logger."
he got his money's worth, That's
Yeah.
that's the goal, I guess. That's a good way to voice that acceptance. I think that's a very
And I
valuable.
think that's an important part of a chronic pain toolbox. I find it one of the most effective things I do.
Wow, yeah.
Yeah, I don't know why. It's like a mystery.
It gives the pain like reason. It
Yeah.
gives it a purpose. It gives it an identity. It gives it a place in who you are. It's
Right.
true acceptance in that
Yeah.
regard. Huh. That's really cool.
So throwing it out there for your chronic pain toolbox. I mentioned it to somebody this week, and he was like, "Never going to accept pain." I was like, "Dude, you have the wrong attitude."
It's going to be a
So
long,
no, it's
hard
really
time.
an important tool.
Yeah. Wow.
No.
Wow. That's fantastic. Oh man. All right. Well, here we are. We've just got a couple of minutes left. You're not doing the mobile thing up the road today?
No, I'm not. Mm-mm.
That happens even on days like today when it's rainy out here, right?
Yeah, I think it's every other Sunday,
Just
so I don't
been-
know where they are on that track of it. But
Right.
they're in the blood bank, right? The blood, what looks like it's not a blood bank, but what looks like a blood mobile. Remember we talked about that, and so they're tucked away with heat and stuff.
Oh, nice.
So it's still, and there's some tents and things. The place they're parked though is kind of a wind channel.
Oh,
So,
back behind the
yeah,
market there. We're
yeah.
talking about the mobile clinic that happens every other Sunday, specifically to address the homeless population here in our neighborhood on Oak Valley Road in Crescent City, just up the street at the market. But yeah, the wind comes howling through there. That's
Right.
oh wow.
So the protection for the providers is pretty good, and they're up in their game as far as what they have available for people, especially with provisions that make sense, like stuff you can dress wounds, little boo-boos with, and, vitamins and food and
Did they get their bus?
Narcan. Yeah.
Did they get their bus? Is that what you're saying? The bus that
It's
they had
not
funding
theirs.
for?
They're borrowing this one from Humboldt.
Okay, because they're having a bus built.
They're
for
having
them.
it
They're having a
made. Even as
vehicle,
we
yeah.
speak, design is happening. So they anticipated probably in a year or a year and a half.
Wow. Okay.
So it's a long process, but it's going to be like everything they've ever dreamed of.
That's
It's
fantastic.
going to be amazing.
That's really cool.
So, no, I did the acute care clinic yesterday, which was well attended. Super fun.
I know that really jazzes you.
I know. And, well, some significant diagnoses, I think, that can be helpful to people. The nursing team's super helpful yesterday, especially, they always have to clean wounds and stuff. And, sometimes they don't smell very good, and sometimes it's on somebody's dirty, nasty feet. And, they humble themselves, and they really wear their Florence Nightingale on their sleeves, man. They are rock stars
That's
about
fantastic.
it. So, and they've got labs available, stuff. It's just kind of a no barriers clinic. I kind of like that.
That's terrific. That's every Saturday now at the Open Door Clinic here in Carson City too. Lynn Szabo, thank you so very much for this week's Health Matters, and have yourself a great week. And I guess we'll talk about any clue about dementia.
How to prevent it? Really? That works? Yeah, we're going to talk about it.
Okay,
Pearls
wonderful.
for dementia.
All right. Walking, right?
Yeah, exercise is always in there and
It's
can't
always
get
in there.
away
That's
from
true.
it.
Okay. All right. That will be next week. Health Matters right here on KFUG. Thank you very much, Lynn.
You're welcome.